Wednesday, October 23rd, 2013. Welcome aboard, everybody, to another live edition of Fire Your MD Now. 866-582-9933. That's the number to call, 866-582-9933. A lot better than your medical insurance premium because it's free. A lot better than the advice divvied out by your MD concerning the pathogenesis and treatment of chronic disease, because their methodology is old-fashioned, outdated, out of sync, dangerous, expensive, and quite frankly, deadly. The best possible thing that can happen, the best possible outcome that can happen when you are under the care of an MD when it comes to a chronic illness, things like asthma, arthritis, type 2 diabetes, anxiety and panic attacks, etc., is symptom suppression and symptom management. Symptom suppression and symptom management. Now, if symptom suppression and symptom management is what you're into, then God bless you. And just go and have a great time with prescription medication upon prescription medication upon prescription medication, and then bankruptcy, and then death. Meanwhile, the quality of your life is completely in the toilet because you can't fix a nutrient deficiency disease with a drug, and most chronic diseases are rooted strongly in nutrient deficiencies. Let's talk about blood pressure. Your body has two types of blood vessels, arteries and veins. Arteries carry blood away from the heart. Veins carry blood back to the heart. The only difference between an artery and a vein is the artery has a muscle in it. The vein does not. The muscle in the artery constricts and relaxes, and constricts and relaxes, and constricts and relaxes in response to unseen stimuli by the body. When the muscles in the arteries constrict and then relax, guess what happens to the blood inside the artery? It gets pumped downstream. Nature is a wonderful thing. Nature has built in an auxiliary heart pump, an auxiliary blood pump into the blood vessels themselves, so the muscles in the arteries constrict and relax according to invisible signals that they get somewhere. How does that happen? Nobody knows. Medical science doesn't care, doesn't know. You would think that they'd want to know what causes this stuff to happen, but they don't. They're clueless about it. And so the muscles constrict and relax to help the heart pump the blood. This is a good thing. However, a muscle is a muscle is a muscle, and what muscles need to constrict and relax, among other things, are calcium and magnesium. So if you are calcium deficient or magnesium deficient, most people are both, then the muscle will constrict, but it can't relax. Now, when you get constricted muscles anywhere, that equals what? A cramp. You get a cramp, right? You get restless legs at night in bed, that's muscle twitching and ticking and cramping. You get really bad menstrual cramps, of course, that's an easy one. That's a muscle cramp. You get Charlie horses at night and your legs in bed, that's a muscle cramp. You get twitches of your eyelids or your facial muscles or little fasciculations of any muscle group anywhere in the body, that's a muscle cramp issue. Well, the problem with the blood vessels is that the type of muscle in the blood vessel is a type of muscle fiber. It's called smooth muscle. It's the same type of muscle that is in your digestive tract. And when smooth muscle constricts and relaxes, you can't feel it. You can't feel it. When skeletal muscle constricts and relaxes, you feel it. So if you get a bad menstrual cramp, you feel it. If you get Charlie horses in your calf muscles at night in bed, you feel it, right? You can see a muscle twitch in your face, and you can also feel it, because skeletal muscle is different from white muscle, and white muscle or smooth muscle. And smooth muscle is found inside the digestive tract and inside the arteries. When smooth muscle constricts, you can't feel it. It's completely, you cannot feel it, have no idea that it's happening. So now if you were able to feel smooth muscle constricting, then you'd be in agony 18 hours out of the day, because the muscles of your intestinal tract are constricting and relaxing all of the time in order to help move food downstream. In the digestive tract, you'd be doubled over in pain all day long if the muscles in your digestive tract were the same type of muscle as in your skeletal system. The difference between a smooth muscle and a skeletal muscle is that when skeletal muscles constrict, you feel it, and when smooth muscles do, you don't. So, you've got smooth muscles inside the arteries. Smooth muscles constrict and relax, but if they don't have enough minerals, specifically calcium and magnesium, there might be other minerals that are involved, right? The human metabolism is a pretty complex thing, so your body needs nutrients in order to function properly. When your body runs out of mineral nutrients, one of the first things that happens is your blood vessels, arteries, the smooth muscle in the arteries constrict, but they don't relax. So you get a cramp in the blood vessel. Now, if you're a gardener and you have a hose, and you just have a hose with none of those fancy attachments at the end of it, you just have a hose with water coming out the tip. If you squeeze that hose just a little bit, you put some pressure on that hose and decrease the diameter of the hose, just a little tiny portion of the hose, by the way, what happens to the water? It comes out faster. Well, that's because as the volume goes down, the pressure goes up. Well, that's exactly what happens inside your blood vessels. As the volume goes down, because the smooth muscles have constricted but don't relax, the blood pressure goes up. Now, this is as simple a thing to understand as, well, for goodness sake, 2 + 2 = 4. It's simple mathematics. This is simple physiology. This is simple physiology. This is not pathophysiology. This is not the physiology of pathological processes. This is just normal physiology. I learned this in high school, I think. I can't remember. It was so long ago, I forgot. It was either high school or pre-med. It was pretty elementary is what I'm getting at. So here's what I want you to do the next time you are unlucky enough to be in the same room with a medical doctor giving you advice about a chronic disease. Remember, we're in favor, most of the time, of medical doctors giving you advice about emergency medicine and surgery when it's absolutely necessary. This is their wheelhouse. But when you are in the presence of an MD giving you advice about chronic disease, you should run as fast as you possibly can in the opposite direction. Even if you have to run straight through a wall, better to run through the wall and get a little bruised up than give your body over to the machinations of the MD, Machiavellian, mediocre medical mind. How's that for alliteration? But my point is, you want to have a little fun with your MD the next time you're unlucky enough to be in the same room with them? Ask them what causes high blood pressure. Just say, hey, doc, you went to Harvard Medical School, right? You did pre-med. You've done, 4 years residency, and now you have, 10, 15, 20 years of clinical experience, and you're charging me, a boatload of money to sit down in your presence, oh, magnificent one. I'd like to know what causes high blood pressure. And, they'll tell you, oh, it's genetic, but don't accept that. Say, well, what do you mean it's genetic? There's a gene that codes for high blood pressure. How does that exactly work? What's the biochemical mechanism through which a bad chromosome, a bad gene, genetic material, makes my blood pressure increase? What's the physiological mechanism that actually makes my blood pressure increase? I mean, we can say that everything is genetic, because everything is in fact genetic, because everything in the body comes from chromosomes, right? I mean, you can say that the apple that just fell off the tree was from the seed that the tree grew from, and that would be correct, because all of the information that that tree needed to grow, all of the information that that tree needed to have fruit was inside of that one single seed. So you can say, yeah, well, the reason that the tree has apples and the reason that the apple fell off of the tree is because of the seed that was planted 30 years ago. That would be correct, but it kind of dodges the question, dodges the answer. It's, it's just a bad answer. So what is it, doc, that causes my blood pressure to be so high? And then watch their head turn around, watch smoke start to come out of their ears, because they have no earthly idea what it is that causes high blood pressure. No earthly idea whatsoever as to the physiological mechanism which causes your blood pressure to be high. Now, there is another type of high blood pressure, which is caused by a kidney malfunction. That happens because the kidney filters blood, and blood goes through the kidney normally. It's just stuck there in the middle of the circulatory system, and all the blood in your body goes through the kidney eventually 1 million times a day. Now, if the architecture of the kidney is good, and if the blood flow into the kidney is good, then everything is good. But if the blood vessels have gotten jammed up with calcification, which is caused by a magnesium deficiency, or they get jammed up with cholesterol plaques because of chronic low-grade inflammation. It has nothing to do with the presence of cholesterol, by the way. The deposition of cholesterol has nothing to do with cholesterol. It has everything to do with inflammation. We've talked about that before. But let's say the blood vessels now in the kidney. Eeny, weeny, teeny blood vessels, by the way. There are blood vessels in the kidney that are so small that only one red blood cell at a time can pass through the walls, pass through the blood vessel. That's how small they are. They're eeny, weeny, teeny. There are miles and miles and miles of blood vessel pathways inside one kidney. It's a gigantically complex filtering mechanism. So if the filter gets clogged, because the blood vessels are clogged, blood backs up. And so the kidney understands that the blood is backing up. So it secretes a chemical called renin. It secretes a chemical called renin, which stimulates a biochemical trickle-down effect that squeezes your blood vessels together, that makes your blood pressure become high because the kidney is trying to squeeze more blood through itself, but it can't because it's all jammed up. That's one of the causes of high blood pressure, but it's one of the rarer causes of high blood pressure. Don't let your MD just tell you it's a kidney malfunction and due to renin and angiotensin, because that's only a third of the story. Ladies and gentlemen, fire your MD now. So let me walk you through this once more, right? It's a little complicated, but not that complicated. So the kidney is supposed to filter blood. Blood is in the kidney, but the kidney filter gets clogged because of inflammation, low-grade continual inflammation in the blood, which causes the arteries inside the kidney to get jammed up with inflammation and the resulting deposition of cholesterol. So now you've got a jammed up filter inside the kidney. When you get a jammed up filter inside the kidney knows that the filter is jammed up, so the kidney releases a biochemical called renin. Renin travels through the blood, and renin converts another biochemical in the liver into something called angiotensin 1. And then angiotensin 1 gets converted, guess what, into angiotensin 2. Don't you love how the MDs break everything down? And next year they're going to discover angiotensin 3, for goodness sake. And so now you've got angiotensin 2 in the blood, and angiotensin 2 constricts blood vessels. Now that's what it does. It constricts blood vessels to increase the blood pressure because the body is trying to force. It's kind of like when you get your toilet is clogged up and you get the plunger, and you put the plunger down in there and you press it hard a couple times. It increases the pressure of the water underneath it to try to move the clog out, to try to blow the clog out, right? Well, the body does the same thing. So the kidney releases renin, and then angiotensin, and then angiotensin 2. And then before you know it, your blood vessels all over your body are constricting, and the body is trying to blow the clot, blow the clog out of the arteries in the blood in the kidneys, but that will never happen because it's too extensive. It'll never happen. So you have chronically high blood pressure because you have chronically highly secreted renin, which causes angiotensin, and this is how some of the blood pressure medications are designed to work. They're designed to either block renin or block the conversion of angiotensin into angiotensin 1 or the conversion into angiotensin 2. But these blood pressure medications, because remember, everything is connected and is very complex in the body, so when you develop a man-made synthetic chemical, the intention of which is to block one aspect of this cascade, you always create a side effect. You have to. You have to create a side effect, because if you divert the water, I mean, if you've got a waterfall and water's coming over the edge of the waterfall, and you put a sheet of steel halfway down the waterfall to divert the flow of water, well, you're going to divert the flow of water from hitting the rocks directly underneath the waterfall, but the water now is going to be squirting off to the side, and it's going to create erosion over there. So this is why drugs create side effects, because you are attempting with man-made methodology to interrupt a very complex cascade of intricate biochemicals that have taken, the wisdom of the divine to generate. And so, it's like, who do you trust, man or God? Well, I trust God. This is why drugs have side effects, because when you throw a man-made synthetic pharmaceutical into a complex system like this, you're always going to screw it up. There must be side effects. They have to happen. So this is how the MD goes about it. What would be a better thing to do would be to figure out what is causing the inflammation in the arteries of the kidney and give some type of a therapeutic to reduce the inflammation, stop the inflammation, and then help the body clean out the arteries in the kidney. But the MDs would rather just yank the kidney, right? Because they don't care about that. They don't even think that that's possible. We have people, I've seen people come off of dialysis. I don't know how many, I've seen a lot of people on dialysis get on board with medical nutrition. They're not on dialysis anymore, because once you stop the process that's creating the inflammation, the arteries don't get clogged anymore. And then when the arteries aren't clogged anymore, when you rally the body's defensive mechanisms, when you rally the body's repair mechanisms with science-based, clinically verified medical nutrition, acupressure, acupuncture, homeopathy, oftentimes the body will rally and fix it. I mean, it's that simple. But the MD doesn't know this. So have some fun with your MD the next time. Say, Doc, besides the renin thing, besides the kidney association with high blood pressure, what's another cause of high blood pressure? I'd really like to know, because I've calculated I'm giving you about $3,000 a minute. You went to Harvard. Please, Doc, tell me, besides the renin kidney connection, what is it that causes my high blood pressure? Watch their eyes bug out of their head and their head explode. For goodness sake, ladies and gentlemen, let's end the nonsense now. Fire your medical doctor, and let's talk to Joyce in New York when we come back. I'm Dr. Peter Glidden, and this is Wednesday, October 23rd. Stick around. Welcome back, everybody. Dr. Peter Glidden here, your steadfast advocate for health. Years ago, everybody was convinced that the king was the man, right? And the king was put on the throne by an act of God, and that it was a bloodline thing, and the king was determined by God, and everybody looked up to the king, right? At one point in time, everybody did. Well, everybody right now is looking up to the MD, and the MD's claim to fame is on even shakier ground than the king's was. It is only a matter of time until the MDs fail, because everything that they do outside of emergency medicine and surgery when it's necessary is built on shifting sands. Their therapeutics fail. Our therapeutics succeed. It is only a matter of time until our therapeutics, the knowledge base of our therapeutics, reaches a critical mass, and then everybody in the world will know about it. So if you're a longevity representative, take heart. The battle is a good battle, and don't worry about the people that say no. Leave the dead to bury the dead. We're not interested in people who have closed minds. It's a free world, more or less. People can do whatever they want, and if they want to take the advice of their MDs, then go let them. And they're going to get what they pay for. They're going to get what they deserve, quite frankly. So it's only a matter of time, because you can't keep the truth down. You can't. The truth will always win. And like the fellow said, once you've experienced the truth, you're in its velvet grasp forever. Longevity's understanding of the pathophysiology of disease, and the delivery of treatments designed to support and promote the body's ability to fix itself, to support and promote the structure and function of various parts of the body, is unrivaled anywhere in the world, we get results. And it is only a matter of time until that reaches biblical proportions. Let's go to New York and see what Joyce is up to. Hey, Joyce, thanks for the phone call. You are live.
Yes, this is a follow-up call. I'm the one that fell down the stairs a couple years ago.
Oh, yeah, I remember. Yeah. What did I tell you to do?
Well, you had me on supplements and all that. The problem I seem to be having, even though I've gone gluten-free and not cheating, not doing any of that, is the absorption of the supplement. Like
so why do you say that?
Well, just a short time after I take them, then I end up with diarrhea. And
yeah, well that's correct then. You're correct, Joyce.
At one point, you said to take at least an hour to drink the tangy tangerine, and I don't really know what is setting it off. But anyway, that doesn't seem to have helped.
So is it the tangy tangerine all by itself that gives you, makes you run to the bathroom, or is it any of the supplements, or don't you know because you take them all at the same time?
Well, what I do, I take the OsteoFX. I take that with water, and I take the pills or supplements. I take them all at once at breakfast and then at lunch. And then at supper, I skip the OsteoFX because I take the 2 ounces of that just before I go to bed.
And when do you do the Beyond Tangy Tangerine?
Well, after I, the OsteoFX, I add water, like I said, and took all the other supplements. Then after I do that, I mix up the Tangy Tangerine and sip on it more or less all day.
And how soon after starting the Beyond Tangy are you looking for the bathroom?
Oh, probably 45 minutes later.
Okay, so for the next 3 days in a row, stop the Beyond Tangy Tangerine. Do everything else exactly the same way that you've been doing it, and see if you still end up in the bathroom.
Okay.
That's the only way to know. Now, I think it's the Beyond Tangy Tangerine. And are you doing the old one that's a red color, or are you doing the new one that's an orange color?
Well, I have had both because I don't know how I ended up doing it, but I ended up with the Healthy Bone and Joint Pack and ended up with a powdered OsteoFX, which I did not like, and I went through it. Seemed like within just a short time compared to the already mixed up.
Yeah.
And,
okay.
I didn't care for the orange, but.
Well, all right. So you have to make that distinction when you place your order. Okay. So for 3 days, just stop the Beyond Tangy Tangerine completely. See what happens, and then call me back, and I'll walk you through it. I think it's the Beyond Tangy Tangerine, but we're kind of shooting in the dark until we know for sure. So stop the BTT for 3 days. See what happens with your reaction to it. And give me a call back. This is Wednesday, so that would be Thursday, Friday. So give me a call back on Monday with an update, and then we'll take the next step, Joyce.
I got another question. Are there things in the Tangy Tangerine that my system needs?
Well, there are, but if there's other stuff in the Tangy Tangerine that's causing you intestinal stress, then it's a net negative, because the stuff that's in the Beyond Tangy Tangerine that's good for you is not getting into the blood because of the intestinal stress.
Okay.
So we need to get this dialed in. And if it is the Beyond Tangy Tangerine, then there's things that we can do as a workaround. But it could be the OsteoFX. It could be. It's kind of, it's like a 60-40% chance that 60% chance that it's the Beyond Tangy, 40% chance that it's the OsteoFX. But we'll know in 3 days. So give it a try, and then call me back, and then I'll be able to walk you through what to do once we've nailed it down. Sound good?
Okay. All right. Thank you.
All right, Joyce. I appreciate your follow-up, and I appreciate your trust. Going down to Georgia now to talk to Uda about liver issues. Hey, Uda. Thanks for calling. You are live.
Hey, Dr. Glidden. Thanks for taking my call again.
You're welcome.
I have 2 potential customers. One has the issue with the liver. She had hernia surgery in her stomach right next to her belly button, is constipated since the surgery, and the doctor told her that her liver looks terrible, like of an alcoholic. The woman never drank a drop in her life. She's 50 years old.
Yeah.
That's the
Isn't
first
that
problem, the first customer. Yeah, really.
All right, let's talk about that. Well, when I first met Dr. Wallach, one of the most remarkable, I've seen a number of remarkable health turnarounds under Dr. Wallach's guidance, a number of them. One of the most remarkable was a woman who was in the hospital of Boston. I believe it was Harvard University Medical Hospital. She had a very debilitating liver disease called sclerosing cholangitis. And with sclerosing cholangitis, your liver shrinks and shrinks and shrinks and shrinks and shrinks and shrinks and shrinks, and then you die. Well, she'd had over 20 surgeries. I think it was 24 total surgeries to help her to not get gangrene as the liver got smaller and smaller and smaller and smaller. The doctors would go into the liver and they would put little stints in the blood vessels so the blood vessels wouldn't collapse and she'd get gangrene. So they kept her alive. Remember, they're good at surgery when surgery is necessary. But when she met Wallach, she was on the liver transplant list in the hospital, and she was dying, literally dying, because her liver was like really, really, really bad. She started Dr. Wallach's protocol. Now remember, Doc hadn't seen her. He hadn't seen the blood work. He just knew what the diagnosis was. He actually, over the phone, told this woman's husband what to give her. He got the stuff and started giving it to her while she was in the hospital. I don't know how they worked that out, but they did. And within a month, she was released from the hospital because she had stabilized. Her liver enzymes had reached the normal limit. She wasn't in danger of death anymore. She didn't need to be hospitalized. And within a year, the liver had completely grown back. It completely grew back to normal size. And it was like, oh, my God. The liver is the only organ in the body that can completely regenerate itself. Well, it's the only gland in the body. It's technically a gland. It can regenerate itself. You know, if you take your heart out and chop off one of the lobes of the heart, well, you're going to die because the heart isn't going to grow itself back like that. If you slice your kidney in half, the kidney, you're going to die because the kidney isn't going to grow itself back. But you can remove over 70% of the liver surgically, and it'll grow back. It's remarkable. So there are biochemical pathways in the liver which, when stimulated, cause the liver to grow new liver cells, right? So I love helping people with liver issues because it's one of the easiest things in the world to do. Because remember, what we do is support the body's ability to fix itself, and son of a gun, with the liver, I mean, that's like falling off a potato truck. It is so flippin' easy to do this because the liver is desperately attempting to regrow and regenerate itself all of the time. So the secret sauce for liver support is the Ultimate Daily Capsules and Selenium. The Ultimate Daily Capsules and Selenium. The recommendation, one bottle of Ultimate Daily Caps per 200 pounds of body weight per month. And one bottle of Selenium, Ultimate Selenium, per 50 pounds of body weight per month.
Okay.
This would be on top of the Anti-Aging Healthy Start Pack. The Anti-Aging Healthy Start Pack. So give her the Anti-Aging Healthy Start Pack, Selenium, and the Ultimate Daily Capsules appropriate for body weight. Plus, eliminate the 10 bad foods. Now.
Yeah, awesome. The next one is I have a potential customer. She has not been to the doctor yet. For some reason, she assumes she has cysts by her kidneys. She feels lumps in the back of both sides by the kidneys, and also in her elbow. And these lumps, I felt them. They're kind of hard-like. I almost want to say it feels like a fatty deposit, but in her case, they're hurt on the elbow and in the back of, in the area of the kidneys.
All right, so they're not kidney cysts because you can't feel a kidney cyst. You just can't.
Okay.
All right, so it's not a kidney cyst. And even if it was a kidney cyst, you're born with, if you have cysts in your kidneys, you're born with them. It's a birth defect. You've always had them, and it's not a problem. A kidney cysts in the kidney are not a problem. But what will happen is someone actually does have cystic kidneys, and so they're 25 years old, and they go to the doctor because they have heartburn or something, or a chronic lung cough that won't go away, and they do an X-ray of the lung, or they do an X-ray of the abdomen or something for whatever reason, and they see way in the back there, oh, you've got cystic kidneys, and then they go crazy and they want to do all of this high-tech stuff when, in point of fact, you've had the cystic kidneys your entire life. But the MDs are clueless about this. It's one more reason for people to not trust their medical doctors about chronic disease and to fire them,
Yeah.
and fire them now. All right.
I agree.
So, all right. Well, look, fatty tumors are in the skin, and fatty tumors in the skin, we believe, are caused by oxidative damage to the fat of the skin. So we need to increase antioxidants. And we do that with the anti-aging healthy start pack, selenium, and triple treat chocolate. The anti-aging healthy start pack, selenium, and triple treat chocolate. Plus, of course, a diet that's, has eliminated the 10 bad foods, especially oil and fried food. Now, fatty tumors, I don't know if you're going to have any luck in getting them to go away, but you should be able to have luck in eliminating the pain and not getting any more of them to grow back. So give her the program for 90 days and tell her to tell you what happens. And remember, have her look for other change as well, mood, energy, appetite, because this is holistic medicine. Thanks you to her up against the hard break. Go get 'em, girl. Peter Glidden here, a steadfast advocate for health who is just amazed at the amount of shoddy work that is delivered every day by conventional medical practitioners all across this country. And this is why we have a healthcare meltdown. This is why we have such a strain on the economy from the delivery of healthcare, because it ain't healthcare. It's disease management. There's a gigantic difference between disease management and healthcare, and even when the MDs get it right, they make the correct diagnosis, they use, the least amount of diagnostic discovery. By the way, ever been to Canada? Ever been to Canada? If you go to Canada and you've got a broken bone, they do one X-ray. If you're in the States and you have a broken bone, they'll do 2 CT scans, an X-ray, and an ultrasound in order to drive the bill up, because they're going to milk insurance for as much as they possibly can. But in Canada, it's all socialized medicine. It's paid for by the government, so they have restrictions on what hospitals can and can't do. But, the medicine that they're delivering in Canada is the same type of slap-happy medicine that's delivered in the United States. But in the United States, you'll pay 10 times more for it because it's a free market and it's out of the control of the government. But my point is that even when they don't overdo it with diagnostic stuff, even when they do it by the book and they actually come up with the correct conclusion, oh, you really do have asthma. Oh, you really do have an arrhythmia of your heart. You really do have a rapidly beating heart. Their treatments for it never fix a darn thing. They don't. The treatments don't fix anything. The treatments just manage symptoms, and so guess what happens to the patient? You're going to have to pay and pay and pay and pay and pay and pay and pay because you're managing things, you're not fixing anything, and the management never gets to the root cause of the disease. So the bill goes up and up and up, and this is why we have a healthcare meltdown. The healthcare system doesn't need to be tweaked like Obama's trying to do. It doesn't need to be upregulated or downregulated. It needs to be abandoned 100%. Let's go to North Carolina and talk to Omira or Omira. Hello, Omira or Omira. Thanks for calling. You are live.
Good afternoon, Dr. Glidden. I have a potential customer, and she has carpal tunnel.
Carpal tunnel syndrome. Yeah. I love talking about carpal tunnel syndrome. Boy, she's going to love you in about 3 months because this is a really easy thing to get on the other side of.
Well, her doctor is pressing for her to get an operation.
Yeah, well, right, because that's what they do, right? When everything looks like when all you have is a hammer, everything looks like a nail, and that's what surgeons do. So what she should do is she should ask the doctor for the name of 10 of his carpal tunnel surgery patients that she can talk to see what their results were after the surgery, because the surgery doesn't fix the root cause of the problem. It always comes back And if it doesn't come back in the wrist that they surgeried on, then it's going to come up in the other wrist because you never get to the root cause of the illness. So I would have her be proactive and say, well, look, doc, you want me to have the surgery? I'd like to talk to 10 of your patients who've already had the surgery and see how they're doing a year later. That might pull the wool from her eyes, and she might just take a second or a third look at what her medical doctor is saying. So there's a little tunnel between the end of your arm and your hand. And the blood vessels and the nerves that feed your hand and all of your fingers go through this little tunnel. It's called the carpal tunnel. And it's just like a tunnel. It's kind of like the Callahan Tunnel going from Boston to Logan Airport, or one of the tunnels coming into New York City. There's a bottleneck there, and the walls of the tunnel in the wrist, it's called the carpal tunnel, right? The walls of this tunnel that the blood vessels and the nerves go through, and the ligaments and tendons, has lubrication on it. And when the body is nutrified, the wall of the tunnel is lubricated. When the body is under-nutrified, the tunnel dries up, becomes under-lubricated, and then just moving your hand around causes friction inside the tunnel because there isn't any more lubrication there. So this causes all kinds of inflammation and scar tissue formation. Why does the tunnel lose its lubrication? Because of a peculiar mineral deficiency called molybdenum. M-O-L-Y-B-D-E-N-U-M. Molybdenum. It's a molybdenum deficiency. Say that 10 times fast. So the recommendation is the Healthy Start Pack and selenium appropriate for body weight, and then the secret sauce here, 1 bottle of plant-derived minerals per 50 pounds of body weight per month. 1 bottle of plant-derived minerals per 50 pounds of body weight per month, plus eliminate the 10 bad foods. You are going to be her new best friend. Stick around, folks. Hour 2 coming up when we come back.